And we'll go ahead and get started. So, welcome everyone to our second roundtable for ACOOG-NSS. We are the National Student Society, and this is our second roundtable. We did our first one in January, and we do these on a quarterly basis. We'll start with an introduction to who we are. This is the NSS board for the year. My name is Pooja. I am the president of the NSS board this year. And we do have a couple of other folks on board here who will introduce themselves.
Hi, I'm Brianna, but everybody usually calls me Bree, and I'm the vice president.
Hi, I'm Rayleigh. I'm the social media chair, and I'm also from DCOM, but the Harrogate campus. But my rotation site, I'm a third year, so I'm on rotations. My rotation site is normally Hopkinsville, Kentucky, which is in western Kentucky, but due to circumstances to graduate, I am currently in Appalachia in Prestonsburg, Kentucky, doing internal medicine. So it's been an adventure.
All right. Thank you, Rayleigh. If anyone has questions about rotations or anything like that, feel free to ask. We are all in different stages of training. So Bree and I are both second years. Rayleigh is a third year. And the other members of our board are also third years, but couldn't be here tonight because of their rotation schedules. All right, just a refresher, or for anyone who hasn't been to one of our events before, we'll kind of tell you about ourselves. So, NSS is the National Student Society. We're the medical student section of ACOOG. Our goal is to help osteopathic medical students understand the mission and core values of ACOOG. And our other priorities are to help medical students find community with one another within OB-GYN, since we all have that interest that brings us here together. Um, our goal is also to provide education on postgraduate educational and research opportunities within women's health. And we're also a link of communication between ACOOG as an organization and various OBGYN interest clubs and women's health clubs at osteopathic medical schools. So our priorities for this year are to have greater cross-school mentorship and peer connection opportunities. We also wanted to support on residency preparation resources, and we'll be talking about some of those tonight, including introducing the prelude to residency. We've also been doing webinars and supporting with ACOOG's podcast, which we'll also be talking about. And we wanted to talk about some of the new things we've introduced this year, including the community service initiative we did in March and the student advocacy pathway that we are currently looking to develop. But all of our priorities and initiatives are very much guided by all of you. So we really appreciate you all being here tonight because we want to hear directly from you about what would be helpful for you in your training and as you think about, you know, your preparation for residency and whatnot, we are here to help support you with that. So we very much want to hear from you what will help you in that journey.
So as Pooja mentioned, one of the big things that we have done so far is the National Community Service Initiative. It is new to ACOOG-NSS, and so we're hoping that it becomes like an annual thing for the groups moving forward. So this year the theme was Women's Health is for Everyone, trying to highlight that while there are very many like deficits in women's health, it is not only the improvements that we make for our gender as a whole, but it also like the advancements we make in women's health can benefit everybody, if that makes any sense. Sorry, it's been a long day. Um, so we sent out an emails like encouraging all the different OBGYN, women's health, ACOOG student interest groups, encouraging them to do a community service event surrounding this topic within a 2 week interval within March, Women's History Month. And we're not saying that only two groups participated, but the proof of participation came from um, Ohio University Heritage. Is that what the H stands for, Bree? Ohio University Heritage in Toro Common, California. Um, so basically, we were just having proof that people participated. I know several different groups still had their own community service events. It's just these people were the ones that sent it in and tagged us on Instagram. Um, so at Toro, they had a bulletin board encouraging participants to explain why women's health matters to them. And at Ohio University, they were just sharing different facts that people may or may not have already known. Um, so, like I said, we're looking forward to seeing what we come up with for next year. If you all have any ideas, if any of you all are interested in being on the exec board, you can go ahead and start thinking about these things. They're good to put in your applications for ideas you have. And like Brandy said in the chat, our main way of communication outside of email is Instagram, which is my responsibility. I run that whole thing with the help of everybody else. And if your school or you are doing anything cool or fun and you want to share it with other people, tag us. We love seeing everybody getting involved, whether it's you just scrubbed in a case or your school doing a fundraiser for breast cancer awareness. Whatever y'all are doing, however y'all are getting out there and promoting not just like women's health, but health in general, especially in the hopes of becoming OBGYNs. Connect with us through there.
Yes, thank you, Rayleigh. And also, I just wanted to say if anyone has questions at any point, feel free to just come off mute and ask us. This is meant to be more of a discussion-based webinar, so don't feel like you have to wait until the end to ask any questions. Also, I can't really see the chat while I'm in presenter mode, so if Rayleigh or Bree or someone else can monitor that for any questions, and feel free to interrupt so we can make sure those get addressed.
Okay, so these are just a few of the things that we have coming down the pipeline for us as students. The first is like we're still trying to work on some things in the back end, but we're going to try to like kind of revamp the previous Big Little program that we had into some sort of like peer support network. And really the goal is just like what we said, like kind of with our mission values as well as just to connect us across campuses and build a community. So be on the lookout for that soon. But the really exciting update is coming from the most recent conference that we just had in Orlando. And it's something called Prelude to Residency. So it's going to be launching very soon this summer. And it's meant specifically for students that are early in their OMS 3 year, specifically after you finish complex. And there's three modules. There's one with like resources and tools, preparatory work to get you ready for residency, and then also a module for like residency interview preparation. And there'll also be like a discussion board for everybody that's on it so that you can post ideas, have people respond to you, and then people within ACOOG will be responding as well. But the big exciting thing is that at the end of you completing this, you'll get a certificate that you can then put in your residency applications. And the goal is really just to like have this to show that like we are competitive applicants and we have done work to help us prepare for residency. So I saw that Dr. Herschelroth was on the meeting with us as well. So if I'm missing anything or anything that you can add, please add anything. So
No, you did a good job. I actually wasn't really present for much of this, so I can't really speak to it at this point, but I will learn more as we go along together, and I'll do my best to chime in when hopefully when I have more information.
perfect. Thank you.
I am curious for anyone in the chat, or anyone who's on the call tonight, if you were part of the Big Little program we've done in the past. We would love to hear your experience with that as we, kind of on the back end are developing this peer support network. Also, if you have any questions at this point about Prelude to Residency, we can certainly try to answer them here, but there is going to be a webinar that we will be hosting all about Prelude to Residency, and that will be next month. So if you have any burning questions, we can, try to answer them tonight, but I'm sure a lot of those will get answered in the webinar. So either of those, either if you've been part of the Big Little program or questions about Prelude to Residency, feel free to let us know now. All right, so I'll kind of talk about some of our upcoming programming. So we've been doing webinars on a monthly basis. We had an Intro to Research in OB-GYN webinar in February. Or was it in March? It was in March. So we had our Intro to Research webinar, and in May, we're going to be doing the Intro to Prelude to Residency webinar. So we will have the folks from ACOOG who developed the Prelude to Residency program come and speak to us to tell us all about what Prelude to Residency is, what to expect. So that is expected to happen at the end of May. We don't have a date confirmed yet, but once we do, emails will be going out to advertise for that. So we definitely encourage all of you to come to that. It'll be a really great webinar to learn more about the Prelude to Residency. And then in June, we're going to have a webinar on advocacy. So this is going to be an intro to advocacy in OBGYN. This is part of the student advocacy pathway development that we're working on. This will be the first part of that. So one of our ACOOG board members who's very involved in advocacy within the organization will be coming to speak to us about how medical students can get involved in advocacy. This will also be at the end of June. Once we have those details confirmed, you can expect more information on that as well. So speaking of the student advocacy pathway development, we very much want to hear from all of you about what you are looking for with this. We have a few ideas, of course, but we very much want this to be in line with what all of you want. So your feedback is very much appreciated here. But what we are looking into is how to create a structured pathway for students that are interested in advocacy around women's health through ACOOG-NSS. So we want to be able to get your input on what you think priority issues are that affect women's health, especially around education and care. And the first part of this is going to be that webinar that we'll be hosting at the end of June. That's going to, as I mentioned, be an intro to how medical students can get involved in advocacy. But we very much want to hear ideas from all of you, because that will help us bring these ideas to the rest of ACOOG and really start to develop that out this year. Because I know there are a few folks who expressed interest during our last roundtable. Hopefully, you all are here tonight as well. Or if this is your first time here and you're interested in advocacy, we very much want to hear your ideas of what you would want to be more interested in.
Yeah, and I think Catherine put in the chat as well, just as like like this is for everybody here, but if you know of people that have suggestions or people that couldn't make it tonight, definitely share it with like your groups and your clubs so that way like we can get everybody's input as well.
I have a quick question for you guys. So if we want to get our ACOOG interest groups like involved with like advocacy and ideas, would they just directly email you guys? Because I was on the board, but we just transitioned. So I could always like reach out to the new president or the girls who are running it now and have them link with you guys. I'm sure they would love to do that.
Yeah, I mean, if you are personally interested, you can reach out to us. You can also have your student club or interest group reach out to us as well. And we're keeping track of that through our emails. So when we do have more information to share, we will be connecting with those who have expressly shared interest about this.
Awesome. Thank you guys.
And then Brandy also sent a link in the chat just now. So each year we try to update the contact information as boards transition, just to make sure that we are still connected to all the different student interest groups and chapters or what, however your terminology your school uses. If you're interested in OB-GYN and you got a club that's some way related to that, um, as long as you're established on a campus and you can double check that your schools is affiliated with ACOOG. Um, and also just establish that we have the contact information. So there's a link in the chat. If you are part of leadership, you know the leadership person, please feel free to send that to the current president or vice president of your chapters, have them fill it out so we can make sure that we are still in contact, with everyone.
Yes, thank you, Rayleigh. I'm curious to hear from folks about what kinds of advocacy you might already be doing or what you are hoping to do, or just generally what does advocacy mean to you? I think maybe we can start a little discussion that way.
I'll speak if no one else is, but I'm going to med school in Florida, so I think part of a good advocacy would be just having clear communication with women in general about current like laws and legislation, and also just kind of how to go about seeking like I feel like not a lot of women like have a safety net of like access to physicians or like women's care. So I think being able to provide them with a network of like where to reach out when they need to, what are the guidelines. So I think that would be big, especially like in Florida. So
Yeah, thank you for sharing that. So just to recap what you shared, part of advocacy for you would be developing those tools to help women kind of get the resources they need, especially as it relates to, um, I guess, like changes in legislation.
yes.
Okay, great. Thank you. Does anyone else want to share how they may already be involved in advocacy or how they hope to be involved in advocacy?
I was gonna say, I'm Sarah, by the way. I'm at KCU and I was like on the club exec the year before. And we did a Repro Health Month in February. So we kind of like clustered a bunch of events. But I think sometimes uh like advocacy can just be as simple as like a screening for a documentary. Like we had Aftershock during it's about the maternal mortality crisis. And I think it's something that you can just host it. Like it's low budget. You can do popcorn, like that type of thing. Also in some areas that are a little bit like I guess have more robust community organizations. There's a lot of organizations that you can partner with who are focused on health equity and then plug into those. You just have to do some research on it. I know in Casey there's quite a few. And then I guess the last kind of and then I guess you can do fundraisers for this, all of that. Um, yeah, like supporting grassroots organizations.
Yeah, thank you for sharing that, Sarah. So I guess based on what you've shared, I'm wondering like would it be helpful in this advocacy pathway development to think about toolkits that maybe chapters could use if they wanted to put on a fundraiser with a local organization or if they wanted to do a screening of a documentary relevant to women's health.
No, I totally think that's a good idea. Like some email templates, some things like that that would kind of cut down barrier to entry.
Hi, I'm Taylor in Montana. I was just, along with that, I had just reached out to another gal that's working with like women mutilization that is not super common to hear about, I guess, but it's still happening today. And just to be aware of what this looks like and kind of the conversation piece involving this, that's also a documentary series that we were thinking about doing in the fall. And then for this spring semester, we were going to be doing a sexual assault nurse examiner run through with the clinical coordinator of sexual assault nurse examining at one of the hospitals here to understand kind of like the conversation piece of it and knowing how to respond in these situations.
Oh, that's great. I love the focus on these different types of issues, especially, some of these are like more global health issues that we may not be, we may not encounter as much here in the States, but are, still certainly important to raise awareness about. So, yeah, that sounds great what your chapter is doing.
Hi, I'm Eleni. I'm from William Carey in Mississippi. Something that I think that's super important is us as future OBGYNs and in our medical training, learning how to teach our patients how to advocate for themselves. Specifically, like I feel like a lot of women kind of have various symptoms, whether it's like an infection or they're going through menopause or something like that, and they just think it's normal or like they don't think that they need to reach out to a physician to get that help. Or if they're in a situation where they don't feel comfortable or heard, and not knowing how to go about asking those questions and things like that. So I like how you brought up a toolkit and maybe having a toolkit that we can share with um like relatives, or maybe we can share with our preceptors who can um, kind of send that out to patients so they can learn how to advocate for themselves.
Yeah, I like that. So, kind of going along with the toolkit idea, maybe different types of toolkits. So, toolkits maybe for chapters to be able to kind of replicate what they're doing across campuses, but also materials potentially for patients themselves. So, yeah, I think that is certainly something we can look into.
One last thing, like drives, like period product drives, if there's like a local bank or something that collects like a shelter.
So, are you suggesting like a coordinated effort around drives, or more so like the toolkit idea of how to put on a drive like that?
I guess either could be good. I would require like organizations finding a place to donate locally, but it's something that's worked. We just leave a bin out in our like common area and people can donate for 3 weeks or so, and then someone takes it to the shelter.
Great. Yeah, these are all really great ideas. Thank you all for sharing. And as more come up, definitely feel free put them in the chat or come off mute and share them. But we'll go ahead and move on to the next slide.
So ACOOG has a sponsored, not sponsored, but collaborative Women's Health Minutes podcast. You can find it on Apple Podcasts or Spotify. And this is hosted by Dr. Rupesh Patel. He's a member of the college. And he is kind enough to collaborate with us from time to time to produce different podcasts that are geared towards us as students. So we have one up now from this, I guess, school year. It's introducing NSS, what we do, introducing us as a board. Um, we are actively working on, it's been very difficult trying to schedule this podcast, but we are actively working on recording a podcast with Dr. Patel and a current resident to speak about the difficulties as a student applying to OB-GYN and trying to decide if you need to take USMLE step 1 and 2 or not. I know this is a very hot topic for everybody at my school. I'm assuming a lot of other students feel the same way, especially dependent upon what region you want to go back to, the different programs you're interested in, especially if you want a research heavy one, an academic institution. A lot of these typically want step, or if you're like, I don't want to take step 1, there's an option of taking step 2 without taking step 1 now. It's very confusing. And I know sometimes different schools have different beliefs on which students should be allowed to take it and which students shouldn't, and with their little like um, benchmark scores you have to get and whatnot. So we're hoping to mitigate some of this confusion and stress with this podcast, especially for um, current OMS 2s and OMS 1s. I know for people like me, it's getting kind of close to the wire, so we're trying to get this podcast out as fast as possible. Um, and we are totally open to new ideas for podcasts, things that you all think would be a good topic to hear as a student. There are wonderful other podcasts that have nothing to do with us that are all about women's health and different topics that you can listen to on your own time for education. And there's previous episodes from the last NSS board, but the current board is working on this one and has the previous one out. But that one's mostly about us and NSS. If you want to listen to it, go for it. But we're hoping to get this one out as soon as possible.
Yeah, and Dr. Patel also just puts on like a lot of really interesting like non-student topics as well, like different updates in women's health, things that are coming down the pipeline. So it's also just a really great resource to have for like other things as well. So
And he likes to cap them at 30 minutes. So it's not like you're listening to an hour long, 50-minute long lecture like you are in a classroom and you want to put it on 2 times speed and finish it as fast as possible. But if anyone has any ideas for podcasts, feel free to send them in the chat. Tell us now. DM me on Instagram or DM the NSS Instagram, aka me. Tell your friends if they have any ideas or anything they think they need to know about. They can DM us, email, um, either thing. Just let us know.
Riley, so do you have I know that the schedule has been a little difficult with Dr. Patel, but do you have the speaker that has that complex experience that wants to talk about?
He
Or,
has a speaker, but she has recently been out of the country working as a resident. So
oh,
she's coming back to the country. We're trying to schedule the recording as soon as possible. So he has a speaker.
okay.
Yes. Because he
Uh,
didn't feel comfortable being so far removed to speak about this, but he has a current resident to speak.
on that subject.
Yes.
Okay. Just wanted to double check. Thank you.
You're welcome. But yes.
and then we also just wanted to like encourage you guys as well, just to remind like the people in your chapters and at your schools and your friends that student membership it is ACOOG for free for all medical students. So it's a really great resource because you always get updates again on things happening. It's always really exciting. And then to make sure that like as your clubs are forming as well, that you become affiliated with ACOOG-NSS. So we have the email of Catherine here, who's like the ACOOG membership manager. So if you aren't sure what the status is of your club, or you want to make sure that you're affiliated, everything like that, definitely send her an email so that way we can make sure that you're getting all of our communication and like everybody in your organization can as well. And then just kind of as like a very brief reminder is that we're kind of going through like a rebranding phase, as you can see with this like exciting new logo that we have. So before like using any ACOOG logo on any like school merchandise you make, like t-shirts, sweatshirts, anything like that, please definitely confirm like your chapter status with us and then like send anything that you were like wanting to use so that way you can get approval before it's made specifically. And making sure that again you have like the updated logo under here. And Brandy has some more information in the chat as well. And she's the one that's been the master brain behind all of this. So we love Brandy for all the work that she's been doing.
Yeah, if anyone has any questions about your chapter's affiliation or branding, just, feel free to let us know. You can reach out to us or you can reach out to Catherine if you want to know your club standing, as Bree said. And just a reminder that, you know, make use our new logo. Um, do not use any of the old ACOOG logos that you may have seen in the past. And those are some images there to reflect what our new logo looks like. All right, so at this point, we really wanted to keep it an open discussion with all of you, and we really want to hear from you all. What support do you need? Like, where can ACOOG-NSS help you? Um, and what resources would be really helpful for your chapters? And what topics for future webinars or podcasts would you like to see from us? So feel free to come off mute and share. We really want this to be an open discussion. Or also, if you just want to highlight something really cool that your chapter has done, we would love to hear that too.
So I know during the last Utah conference, they did like a residency interview thing for med students. I think that would be good if there is like either a segment on that or resources that you guys can share with us. Because I know I couldn't attend it because OMS 2 this year, and I know it was for third and fourth years. So that would be cool if we still had something along those lines with like the questions that the program directors like ask, high yield stuff.
Yeah, that's great. I do think the prelude to residency may answer a lot of those questions. But I hear what you're saying. Yes, I also was in attendance at that conference, and as an OMS two also at the time. It would have been nice to know what the interview questions were that the OMS threes and fours got to practice.
Yeah, I was about to say the same thing. I believe like in the Prelude to Residency that's coming out very soon, there is a module that's specifically just for like residency interview preparation. But we can definitely take down the suggestion as well of like maybe even keeping the like practice interviews, maybe expanding it, seeing what that looks like exactly for people that aren't able to attend the conference, things like that. So thank you for that.
You can do a roundtable like this and do groups and do the virtual interviews, FY.
Yeah, that's definitely something we can definitely look into. If that would be helpful for students to do mock interview sessions during one of these roundtables.
I would agree with that, and you can also ask some of your professors at your schools to do mock interviews if you want to get a diverse set of questions. We do a lot of that. The residents do that, and some of the medical schools used to do it. I don't know if they still do, but that's a really good place to start. And just so you guys know, and this is Dr. Herkelroth, and I didn't introduce myself before. Let me turn on my camera. It's nice to see everybody here. I'm the with the M&P ACOOG committee. And so I think you guys are doing a beautiful job. So we are typically the fall conference is the one that was sort of geared towards the students more. And we are in discussions as what's going to happen with the fall conference. And there's a lot of things that will probably come down the line in the next year, and we'll be able to share those with you. But we are definitely keeping you guys a priority. So don't worry, it's not going to, those mock interviews won't go away. They just may be moved around a bit, but they're not going to go away.
Thank you.
Anyone else want to share supports that would be helpful, resources that would be helpful, or just anything really interesting your club is doing or has done that you would want to share?
Well, I'll jump in with a logistics question. So this is Catherine. I'm on the staff. You saw my email earlier about registering a new chapter. If you aren't sure if your chapter is registered, that was me. But a logistics question. So if we're talking about the potential of maybe doing mock interviews online, scheduling wise, right? And just thinking about when this time slot falls across the country in multiple time zones. How do y'all feel about this particular time zone? Do you have peers who would love to be here on this call, but it didn't hit their schedule? Is there a better time for this? Maybe there's not an easy answer to that, but if something is obvious to you, drop it in the chat or let us know so we can make sure that we make resources available at a time that works for y'all. Because you're juggling a lot and we're not trying to make it more complicated. We want it to find the sweet spot. So just let us know if you have an idea on that end. Thanks.
Thank you, Catherine. I can share something that my school started kind of this year that I thought was pretty cool. So we have a simulation lab at Toro, California, and we offered a kind of a simulation lab series on emergency obstetrics. So we had mannequins and we kind of ran through different scenarios. Like we did a shoulder dystocia case, we did preeclampsia, we've done postpartum hemorrhage, and these are not scenarios that are normally taught in our reproductive health curriculum. So this was a really neat opportunity to be able to practice some of those skills with our mannequins. So if that's of interest to any of you guys, if you have simulation labs that could support something like that, I'm definitely happy to speak more on that.
In a similar vein, just doing like pregnancy specific OMM workshops. I know that we're taught, at least at our curriculum, we're taught some things, or it's noted that this would be good for someone who's a pregnant person, but specifically having a professor lead like a 30-minute workshop. We even had some students who had spouses who were pregnant and they came in and they had the OMM performed on them and it was good. So
Oh, that's very cool. I'd definitely love to know more about that. I know at some point the board, our NSS board, was collecting these chapter updates from all of you on different events that you were doing. So it'd be great to hear about stuff like this so we can share it out more broadly with everyone, and then it can be an opportunity for other chapters to do these events. So
we
yes,
we have
sorry.
we have a committee that is working on filming some hands-on for and we're going to put them on the website. But we do have a committee from OMM who's working on with actually a group of students to develop videos and resources so y'all can see it as y'all continue with your education.
That's great. Yeah, thank you for sharing that, Martha.
I also wanted to share. I'm gonna turn on my camera because I feel like I've been talking a lot. My one of my colleagues, Jess Bick, says she's here, but we did a Women's Health month thing at our school where I thought it was really cool. We had different programs coming in. We had a talk that went through like mammograms and like we had a radiologist. It was like a 5 hour event, and then we had like a we did so many things. I'm trying to think. We did a IUD insertion and all that stuff. So I thought that was really cool. Something we did this year that worked really well, and we were allowing students to participate, learn a little bit more hands-on, and had OB-GYN that were local to us helping us out. So
Wow, that sounds really cool. Sounds like it probably took a lot of effort to coordinate something like that as well, right?
yeah, shout out Jess Bix that she's in here. So she did a lot of that, and we're very grateful for her.
Thanks, Arena. That's so nice of you.
That's amazing. Yeah, I think if you haven't already done so, whenever the chapter update comes out from us, please give us more information on that. I think that would be a really cool resource to share with everyone else. All right. Well, if there are no other questions or updates, we just want to do our closeout here and just remind you of how you can remain connected with us. This is our email. Feel free to reach out. We check our email very frequently. So if you have any questions about anything, or if you want to share your interest in the student advocacy pathway, or have ideas for webinars or whatnot, feel free to email us. We will be keeping track of all those things there. You can also connect with us on Instagram. Rayleigh does check that very frequently, so feel free to DM us on there as well. We do have our link tree that connects to all of our various resources. Um, and as for when our next roundtable is, we do these quarterly. So our first one was in January, and our next one will be at the end of summer in July. So be on the lookout for that as well. And our next webinar is coming up at the end of May, and that's going to be all about Prelude to Residency. So please come join us because the folks from ACOOG who developed that resource are going to be speaking on it. So they will be best positioned to answer any questions you may have about Prelude to Residency. But yeah, that's what we have for you tonight. Feel free to ask any questions, any lingering questions you may have. If not, I'll kind of leave it open for anyone else to share anything. Anyone from our ACOOG staff or anyone on board, Rayleigh or Bree, if there's anything else you wanted to share.
You're doing a great job. Keep it up.
Sarah did ask in the chat if we had a shared Google Drive still, and I am not aware of one for like all of the student members of ACOOG. Pooja, I don't know if you are.
Yeah, that's a good question. I guess that would depend on kind of the purpose of the drive. Are we thinking like sharing resources with one another? Is that kind of the intention behind a shared drive in that way? I don't know if Sarah, you said it was Sarah, right? If Sarah can speak on that.
I think Sarah left,
Oh, okay.
but
Oh,
thank
good.
you, Sarah.
I'll jump in with a little context, kind of teasing what's coming soon, which is on the backside, the staff of ACOOG is working hard to roll out a new interface. So website will look different. The way we interact with y'all will have some new features. So as staff support for this particular group, I'm on the lookout for ways that we can find an online channel to facilitate conversations amongst the group, meeting notices in a centralized place, and there could be some information sharing there too. It just depends on once we get up and running with the new platform, figuring out what the best channel is for that within that platform. So hopefully we'll have an answer for that as we move to something new and shiny. You're gonna like it. I know we will. So stay tuned.
All right, well, if there's no other questions or comments, this is the end of the roundtable for this evening. We really appreciate you all coming out tonight, and be on the lookout for our upcoming events.
Thank you, ladies. Have a good night.
Good night.
Good night.
Good night. Great job, you guys.
All right, looks like it's just